Dr. Manish Bansal MD Jacksonville on Tricare. What is a Tricare? Tricare, formerly known as the Civilian Health and Medical Program of the Uniformed Services, CHAMPUS, is a healthcare program of the United States Department of Defense military health system. Tricare is the military's health insurance program, and it comes in 4 modes: Tricare Prime, Tricare Extra, Tricare Standard, and Tricare for Life. Tricare, the military's health insurance plan, covers everyone: active duty members, retirees, and their families. However, retirees and their dependents have to chip in for the cost of coverage. The Tricare Prime option is very much like an HMO, or health maintenance organization. Like an HMO, you're assigned to a primary care provider, PCP. This is usually, although not always, a military medical facility. You receive most of your healthcare needs through the PCP. Like most HMOs, in order to receive care from a specialist, you must first receive a referral from your PCP. Tricare Prime requires you to enroll and pay an annual enrollment fee, plus you pay a small fee called a cost share in the military, each time you receive medical care. When you receive medical care under Tricare Prime, you don't have to file a reimbursement claim. The provider automatically does this for you. The Tricare Standard program gives you the greatest flexibility, but it costs the most. Under this program, you can see just about any medical provider you want. As with Tricare Extra, you pay an annual deductible. In addition to the deductible, you have to pay 25% of what Tricare says the medical service should cost. Tricare provides civilian health benefits for U.S. Armed Forces military personnel, military retirees, and their dependents, including some members of the reserve component. The Tricare program was managed by Tricare Management Activity, TMA, under the authority of the Assistant Secretary of Defense. Tricare is the civilian care component of the military health system, although historically it also included health care delivered in the military medical treatment facilities. What isn't covered by veterans' Tricare health insurance? Tricare covers most inpatient and outpatient care that's medically necessary and considered proven. However, there are special rules or limits on certain types of care, while other types of care aren't covered at all. Some services or treatments require prior authorization. A few examples of medical procedures that aren't covered are abortions, unless the mother's life is at risk. Condoms. However, other forms of birth control that require a prescription, such as birth control pills, are covered. Cosmetic surgery or drugs used for cosmetic purposes, such as Botox. However, cosmetic surgery to correct a disfigurement, such as the result of an accident or burn, is covered. Non-surgical treatment for obesity or weight control. Smoking cessation products and treatment. Most dental work. The military has a separate insurance program for dental care, however, dental care that is medically necessary and the treatment of an otherwise covered medical, not dental, condition is covered. Cases of suspected Tricare fraud are investigated by the Department of Justice. Defense Department officials said they could not comment on the report. Air Force Major Benjamin Sacrison, a DoD spokesman, said the Defense Department cannot discuss potential or ongoing investigations, or whether or not a specific individual or entity is the subject of an investigation. Tricare officials said Tricare last year closed a loophole in its compounded medication pharmacy policy that allowed for some physicians to prescribe medication in exchange for kickbacks. As part of that change, the DoD recouped more than $240 million while the Justice Department still has more than 100 investigations underway, so beware while dealing with the health insurance provider and insurers. Dr. Manish Bansal is a topical specialist in Jacksonville FL. To know more about him, please check his website www.manishbansal.com.